Good afternoon, my name is Chief Silva and I'll be giving you an informative speech on first aid. This speech is required for my speech class and this is a requirement for a 5 to 7 minute speech. Alright? So who in this class or who in this audience can define what first aid is?
Providing care on the spot to an injured person.
Roger. It's on the spot, first response, medical attention given to the casualty until you can have medical teams come and assist you and take them to a hospital. Alright? The steps involved in first aid, the first step is evaluating the casualty. By evaluating the casualty, it means seeing what the issue with the casualty is, like i.e., is it bleeding, is it breathing, is it a shock that the casualty is in, or is it a burn or a fracture. Those are evaluations that you as a first responder are going to do. Check? Alright, the three criteria that we're going to use for our first aid class is first, checking for responsiveness. Responsiveness could be something as simple as walking up to a casualty, to a victim, and asking them, hey, are you all right? Hey, what's your name? Hey, what happened? And responsiveness can be gauged by seeing their response, like hearing them out. Like if I ask Edgel, hey, what's your last name? And if he says something else, that means he's probably out of it. All right, that's what responsiveness you're looking for when it comes to the first aid. Next is breathing. Breathing, we're going to look for a rise and fall. If the patient or the victim is conscious, you're going to look for a rise and fall on their chest, or if the individual is unconscious, you can also feel for the air. If they're not breathing, check for some obvious obstructions in their airways, i.e. like choking on food or some other sort of obstruction in their passage. And the two ways you're going to clear the breathing issue would be by clearing the obstruction, obviously, but also by CPR. Okay? The next evaluation for a casualty that we're going to do is an overall visual check for bleeding. All right? When 99% of the injuries that result in fatalities are usually because of bleeding. When you do that, check for visual signs of excessive bleeding. Check for spurts of blood, like from the back, where it's to your eye, you cannot see it unless you move the patient. But try and see if there's a puddle of blood underneath the patient or the casualty. That's what you're going to treat for. The two treatments that we're going to use is applying tourniquets and raising the limb. Applying tourniquets above the wound will stop the blood from flowing freely through that wound. So, and the second thing is raising the limb. Like if it's an arm, try and raise that arm over their heart, slowing down the blood flow. Check. The last one that we're going to use for today's speech purpose is checking for shock. Shock is a inadequate blood flow to the vital organs in your body. Right? Like i.e., less blood flow going to your brain will make you go into a shock. If not treated, it could cause serious injuries or also fatalities. Right? The way you treat for that is loosen up the clothing. Like for us in uniform, loosen up our belts, loosen up our boot blazers, our sleeves, and the second thing that you got to do is maintain the body temperature. If it's hot outside, pull the casualty into the shade, try and cool them off. If it's cold inside, then take them out or put them in front of a heater, something like that. You want to maintain their normal body temperature. Next is the conclusion. So today we were supposed to talk about what is first aid. We accomplished that. Evaluating the casualty with responsiveness, bleeding, breathing, and shock, and how to treat those three symptoms. Are there any questions? If not, thank you for your attention. That concludes my brief.